In order to talk about endometriosis, we have to first see what is endometrium. So endometrium is the internal most lining of the uterus. It is epithelial tissue in nature, and during menstrual cycle the endometrium it grows and becomes thick, and blood vessels they enter into the area, and the endometrium become highly vascularized, mean have a lot of blood vessel, and then it also becomes glandular during the uh, menstrual cycle. Here we can see during follicular phase the endometrium start to grow, it becomes thick during follicular phase, and after the follicular phase there would be ovulatory phase. During ovulatory phase it start to become secretory. It is growing, but it has become, the glands they are now prominent, and it has become secretory. It start to secrete its secretions. These glands are exocrine type of glands, so they are releasing a lot of fluid, mucus. And then during luteal phase, this green phase, it is again getting thick and is secretory. During menstruation, these endometrium it start to slough off, it start to fall off, and there would be bleeding due to breakage of these blood vessels. So this endometrium, if it grows outside of this uterus inner lumen, it would be called as endometriosis. So we see it in the coming slides. We said that the endometrium it should be present inside the lumen of the uterus here, but if it appears anywhere else than uterus, the lumen of the uterus, it is most of the time outside of the uterus, on the fallopian tubes, on the ovaries. If these lining they may develop, or anywhere on the in the body other than uterus, that would be called as the endometriosis. So this endometrium, because in normal function it is respondent to estrogen, so it would develop when follicular estrogen is released. So in body, if anywhere else endometrial lining is present, it would also develop when there would be estrogen hormone. So it is called as estrogen dependent condition, and it mostly because it is dependent on estrogen. So when the time during estrogens are present in higher level in the body, this condition may appear. So the age of onset and presence would be 20 to 40 year of women. So it is during reproductive age only, and after reproductive age, that is menopause, it uh, goes away. And similarly during pregnancy, because high level of progesterone are present, and so there would be decrease in the condition, that is endometriosis. So pregnancy and menopause, they would, or we can say contraceptive that are having higher level of progesterone, would cure this disease, that is endometriosis, because it is estrogen dependent. Endometriosis may have genetic predisposition. One of the gene, Keras gene, is an important gene that is found mutated in endometriotic women. So the Keras gene is belong to the RAS family of genes, and it is oncogene. When it is mutated, it would result in the conversion of one type of tissue into another type of tissue, that is called as metaplasia, and then it also result in the uncontrolled growth of the cells. So this gene is found mutated. So when the uh, family members of a woman are affected with endometriosis, then there would be more chances of getting endometriosis to that moment, and about 7 times more chances are there if mother or sisters of the woman are affected. So then there are three main theories that are being uh, claimed about the uh, occurrence of or mechanism of formation of endometriosis. So endometriosis, as we said, is the formation of endometrial lining outside of the uterus anywhere in the body. So the most accepted theory is called as Sampson theory. It is about retrograde menstruation and implantation. So the this theory claims that the normal flow of menses is toward the vagina, that is away from the uterus. But in case of retrograde mean it is retro mean behind. Retrograde menstruation is backward flow of menstrual blood. So menstrual blood, instead of going toward the vagina, it would go back into the uh, um, oviducts, into fallopian tubes, and into the from the fimbriae it would fall on the ovaries and into pelvic cavity, that is the abdominopelvic cavity. So between the wall of the body and the this reproductive tract, this blood would flow, and this blood, that is the menstrual blood, may have stem cells. These stem cells, they would uh, grow on the outer walls of the reproductive tract or in the nearby areas of the in the pelvic cavity. So these may be on the peritoneum that is present in the cavity, or pouches that are formed between the reproductive tract and the body gut. uh, so these would be present, these cells, they would fall on those pouches or the gaps, and they would develop. If the retrograde menstruation and implantation theory is the most accepted because in women that have blocked uterus, they would have most of the time the retrograde flow of the blood into their pelvic cavity, and they have higher uh, chances of getting endometriosis. They have higher prevalence. Higher prevalence is found in those women that have blocked uterus. So this retrograde menstruation and implantation is most accepted. But the retrograde menstruation is common in case of women that are in reproductive age. About 90%, up to 90% women, they have retrograde menstruation. So the endometriosis, it is about 3%. So it is not that common as that of the retrograde menstruation. So all the women that have retrograde menstruation flow, they are not developing the uh, endometriosis. So there are underlying causes, and few of them suspected are that if inflammatory responses are there, cytokines are there, growth factors are there, and these and there would be angiogenic factors, inflammatory and growth factor, they would grow these cells, that stem cell that have come out of the uh, oviducts or fallopian tubes, and in the menstrual blood, and the angiogenic factor, they are to grow blood vessels in these cells. So when they fall on the surfaces, on peritoneum or the outer surfaces of the uterus, ovary or the fallopian tubes, there the growth factor grow them, inflammatory factor produce inflammatory response, and the angiogenic factors, they would develop blood vessels to provide them blood supply to increase their growth. So these if the women, they have this these genetic mutations, they have genetic setup for development of endometriosis, or they have inflammation, they have growth factor available. So these environments, if they are available, then there would be development of endometriosis. There are two other theories that are about coelomic cells that would develop into the uh, into types of the endometrial lining. So we know the epithelium, endometrial lining, and the coelomic uh, lining, they would develop from same type of tissue. So they are interconvertible, mean their ancestors cells are same. So when there is another theory that the coelomic cell that are present nearby in gut, they may develop into the they undergo metaplasia. Metaplasia mean conversion of one type of cell into another type of cell. So they would be converted into the endometrial lining. So another theory is induction theory. Induction theory is like coelomic metaplasia theory. It is that the cells that are undifferentiated present in the peritoneum would be converted into the or would develop under the action of hormones that are estrogen into the endometrial type of cells. So these three theories, they are about the development of endometriosis, but the most accepted is retrograde menstruation and implantation theory. Here are the common and rare sites of the endometriosis. The endometriosis would commonly occur on ovaries, on peritoneal pouches, the pouches between rectum and the uterus. This pouch is made up of peritoneum. So these are also called as retrouterine pouches. So when the stem cell, they fall from the backward flow of the blood, they would reside in these pouches, and there would be development of blood vessels, and there would be development of those stem cells into endometriosis. And then could be the commonly found on colon, the part of large intestine, and could be found on outer surfaces of the reproductive tubes, could be on the outer surface of uterus or the fallopian tubes. And rarely the endometriosis is also found on inside nose and pleura and lungs and the scar sites, and this is due to the most of time due to the traveling of these stem cells through blood vessels. When these stem cells, they develop blood vessels, they through angiogenesis, few of these cells may enter into the blood vessels, and they would reach to certain other body parts or regions. So in case of nose, they may reside inside nose and develop over there. So endometriosis would develop in nose. Those women may be complaining of nasal bleeding during their menses. So they are rare, but there are certain cases of nasal bleeding during menses that is due to endometriosis. And then there could be uh, these cells, they may reach to pleura and lungs, maybe the membrane that is lining the lungs, or on the outer surfaces of the lungs, they would reside over there. And they could go to the scars tissues. For example, during C-section, cesarean section, the uh, uterus is cut, and the stem cell, they come out and they may reside on the other tissues, and when there would be a menstrual cycle in those women would be maintained after birth, after 3 months after birth. So these stem cell, they start to develop like endometrium, so there would be formation of endometriosis. uh, these three regions or other few regions, they would be rare, but commonly ovaries, outer surfaces of reproductive tubes, colon, and the this pouch of Douglas or the retrouterine pouch, they are the common sites of development of endometriosis. So the endometriosis would result in severe pain and the chronic pelvic pain. They are the representative of the endometriosis, and the reason of the pain would be pelvic adhesions. Pelvic adhesion is that the patches that develop on the outer side of the reproductive tract, they may get bind to other tubes and other structure present in the abdominopelvic cavity or with the body wall, that would cause the pain. Another thing is distorted anatomy. So due to adhesions, the anatomy of the all the structure would be distorted, and the patches that develop, they would distort the anatomy of the tubes. And then there could be inflammation due to the release of inflammatory chemicals, and then there could be bleeding out of, because the blood vessel, they develop in these patches, so there would be bleeding from these patches. And then there could be burrowing of these patches into the peritoneum. Peritoneum would be uh, affected, it would have burrows and holes, so there would be type of hernia type of condition that would cause pain. So these all things that would be the result of endometriosis would cause severe pain or chronic pelvic pain. Endometriosis is characterized by severe pain in pelvic region. So these women, they would have chronic pelvic pain for long time, severe chronic pelvic pain. But the intensity of pain is directly proportional to the invasion of the stem cells or endometriosis deep into the tissue. The deeper the invasion, the more would be the pain. So these chronic pelvic pain could be in form of dysmenorrhea. Dysmenorrhea are the pains during menses, but in case of endometriosis, so the women, they mostly feel this dysmenorrhea, that is a common condition during menses, but painful menses, but the uh, dysmenorrhea in case of endometriosis is more severe, mean severe pain would be felt. And then this could be dyspirunia. Dyspirunia is the uh, pains during sexual intercourse. So if there are patches on the tissue and they have invaded into the tissue of the reproductive tract, there would be pains during the sexual intercourse. So pain are the most important sign of the endometriosis. There would be chronic severe pelvic pain, and then there would be infertility also. So the women that have endometriosis may be are infertile, and the endometriosis is mostly found in women that are never given a birth, that are called as nulliparous women. They are having more chances of endometriosis. Endometriosis is also found to be associated with the pelvic cysts. So there could be cysts that are endometriosis cysts. The endometriosis is an obvious cause of infertility in women. So idiopathic infertility cases, they may have 40 to 50% prevalence of endometriosis. So the endometriosis should be probed in idiopathic or the unexplained type of infertility in women. So these endometriosis, if it is present in ovaries, it would cause defective follicular development, and if it is present elsewhere in tubes, it would also affect the follicular development and ovulation, because it is correlated with the higher levels of inflammatory um, um, chemicals. So these molecules, they would affect the follicular development, and they may result in an ovulation. So the endometriosis, it indirectly may affect the ovulation process. And then if it is present in tubes, the it would distort the anatomy of the tubes. There would be pelvic adhesions, and then the fimbriae, or the uh, fingers of the uh, fallopian tubes, if they would be distorted, they cannot collect the eggs from ovaries, because in normal condition they would keep on sweeping on the ovaries to collect the eggs that are ovulating. And in case of the endometriosis, they would not be able to collect eggs, so there would be chances of no conception. And then the inflammatory chemicals that are present due in the reproductive system due to the uh, endometriosis, they would give immune response to sperms, and the sperms, they would be destroyed, or they would be masked, so they cannot come in contact with ovum, and cannot result in fertilization. So there would be infertility. The endometriosis is characterized by pain and infertility. So the treatment for these two conditions are medicine and surgery. For the pain management, most of the time it is the medical treatment, that is in the form of painkillers. If the pains are mild, the painkillers or the oral contraceptive pills are used. Painkillers would be non-steroidal anti-inflammatory drugs, and aspirin and brufen, they would be used. And these painkillers, they would relieve the pain by reducing inflammation. The oral contraceptive pills are commonly used to treat this condition in the women that don't want to conceive. And this oral contraceptive pills, they have progesterone in high concentration, and this progesterone would maintain the lining of the endometrium, and would not result in the growth, and there would be relief of pain. And but they would suppress the ovaries, and ovaries would not be producing a lot of estrogen. So the progesterone, they could be given, but in case of oral contraceptive pills, they would be given continuously. In case of the contraception purpose, these oral contraceptive pills are given for 3 weeks, and then there is 1 week gap for the normal menstrual cycle. But in case of the uh, for treatment of endometriosis, the oral contraceptive pills should be given for continuously in for 3 to 6 months, in order to treat the endometriosis. And the progesterone can also be given. So the high levels of progesterone would inactivate the ovaries. They would not be producing estrogen, so there would be no development of the endometriosis, endometrium lining in the uterus or anywhere else. And then The aromatase inhibitors, they could also be given. They would inhibit the aromatase enzymes, so they would not convert testosterone into estrogen, so estrogen level would decrease. We know the endometriosis is dependent on the levels of estrogen, so estrogen is reduced due to aromatase inhibitors, and there would be less pain. And then testosterone derivatives, they could be given. Testosterone derivatives would give negative feedback to pituitary to not produce LH and FSH, so there would be less LH and FSH, and that would result in lower levels of estrogen, and then there would be less levels of the development of endometriosis, and there would be less pain. And then another thing is Gnrh analogues. So the women that don't want to conceive are given Gnrh analogues. These most of the time they are Gnrh antagonists. They could be Gnrh agonists, but most of the time they are Gnrh antagonists. They would reduce the release of the release of LH and FSH from pituitary, and there would be less release of estrogen, so the ovaries, they would become dormant, and there would be no development of endometriosis or endometrium in the uterus. So all these oral contraceptive pill, progesterone, and the testosterone derivatives and Gnrh analog, they would affect the activity of the ovaries, and ovaries would become dormant for the certain time. So uh, then if the pain is not relieved, if it is severe pain, then there could be laparoscopic surgeries are suggested. Laparoscopic surgeries are the surgeries in which the tubes are passed through small incision less than 1 centimeter from the abdominal wall into the body organs, and through these tubes the long instruments, they are passed, and they are mostly fitted with camera, so their passage could be observed on monitor. And these instruments, they can cut, they can manipulate, they can sew the organs in the inside the abdominal cavity. So laparoscopic surgeries are suggested in case of the treatment of the endometriosis. So these laparoscopic surgeries are used to remove the adhesions of the reproductive tubes with other organs and with the body wall due to presence of endometriosis on the outer surfaces of the tubes. We have to note one thing, that endometriosis does not develop inside the tubes. They develop on the outer side of the tubes toward the body wall. So they are not blocking, most of the time they are not blocking the tubes. They are, because they are present on the outer surfaces, they would affect anatomy. As we saw previously, they would develop adhesion between the tubes and other body structure, and so these adhesions, they are removed by laparoscopic surgery. Similarly, the patches of the endometriosis, they are burned, and then the cystomy may be done if the cysts are present in ovaries and they are greater than 4 centimeter in size, so they would be removed by surgery, that is called as cystomy. And if the cysts are less than 4 centimeter, they should not be removed by surgery, because they could be confused with normal follicles, so they should be drained only. So in case of infertility, the surgeries, laparoscopic surgery, cystomy, they would increase chances of fertilization and conception.